Hello and welcome. Today, we'll be exploring a rare genetic disorder that affects the eyes and sometimes other parts of the body, Axenfeld-Rieger syndrome with glaucoma. We'll delve into what causes this condition, how it impacts vision, and what treatment options are available. Axenfeld-Rieger syndrome, or ARS, is primarily caused by genetic mutations. Several genes have been implicated, with the most common being FOXC1, PITX2, and PAX6. These genes play a crucial role in development of the eye, as well as other organ systems. These mutations can be inherited from a parent, or they can occur spontaneously. It's important to understand that ARS isn't contagious. It's purely a genetic disorder passed down through families or arising from a new mutation. At the heart of Axenfeld-Rieger syndrome lies a disruption in the development of the anterior segment of the eye, that's the front part. This disruption leads to characteristic features like a prominent Schwalbe's line, iris abnormalities, and adhesion between the iris and the cornea. These structural changes can impede the outflow of aqueous humor, the fluid that circulates inside the eye. When this outflow is blocked, pressure inside the eye builds up, leading to glaucoma. Glaucoma, in turn, damages the optic nerve, which transmits visual information to the brain. Over time, this damage can lead to irreversible vision loss. Axenfeld-Rieger syndrome is considered a rare condition. Its exact prevalence is difficult to determine, but estimates suggest it affects approximately 1 in 200,000 individuals. Because it's a genetic disorder, it can affect individuals of any ethnicity or geographic location. Due to its rarity, research and awareness are vital for early diagnosis and management. The signs and symptoms of Axenfeld-Rieger syndrome can vary greatly from person to person, even within the same family. Common eye-related symptoms include visible iris abnormalities such as holes or strands, a prominent Schwalbe's line, and an increased risk of glaucoma, which may present with blurry vision, eye pain, or halos around lights. Beyond the iris can also involve other parts of the body, leading to dental abnormalities like missing or small teeth, facial features such as a broad forehead or widely spaced eyes, and less commonly, heart defects or pituitary gland problems. Recognizing these varied symptoms is crucial for early detection. Diagnosing Axenfeld-Rieger syndrome typically involves a comprehensive eye examination by an ophthalmologist. This examination will include assessing the structures in the anterior segment of the eye, checking the intraocular pressure, and evaluating the optic nerve for signs of damage. Gonioscopy, a special examination using a lens to visualize the drainage angle of the eye, is particularly important. If ARS is suspected, genetic testing can be performed to identify specific gene mutations. Additionally, a thorough physical examination and imaging studies may be conducted to assess for systemic involvement. While the core definition remains the same, Axenfeld-Rieger syndrome can be broadly categorized based on the specific genetic mutation involved. For example, cases caused by mutations in the FOXC1 gene may present slightly differently than those caused by PITX2 mutations. However, clinically, the focus remains on managing the glaucoma and addressing any associated systemic abnormalities, regardless of the specific gene involved. The primary goal of treatment and management for Axenfeld-Rieger syndrome is to control intraocular pressure and prevent vision loss from glaucoma. This can be achieved through various methods, including eye drops, laser therapy, or surgery to improve fluid drainage from the eye. For individuals with glaucoma, regular monitoring of intraocular pressure and visual field testing is essential. Furthermore, addressing any associated systemic issues, such as dental abnormalities or heart defects, is crucial for overall health and well-being. A multidisciplinary approach involving ophthalmologists, dentists, cardiologists, and other specialists is often necessary. Currently, there's no way to completely prevent Axenfeld-Rieger syndrome, as it is a genetic disorder. However, genetic counseling can be valuable for families with a history of ARS who are planning to have children. Genetic testing can help determine the risk of passing on the mutated gene, and reproductive options such as preimplantation genetic diagnosis can be explored. Early detection and management of the condition can also help to minimize its impact on vision and overall health. The prognosis for individuals with Axenfeld-Rieger syndrome varies depending on the severity of the condition and the success of glaucoma management. Early diagnosis and prompt treatment can help to preserve vision and prevent further damage to the optic nerve. However, even with treatment, some individuals may experience progressive vision loss over time. Research into new therapies for glaucoma and gene therapy approaches for ARS is ongoing, offering hope for improved outcomes in the future. Scientists are exploring ways to correct the underlying genetic defects responsible for the syndrome, which could potentially lead to more effective and long-lasting treatments.